few sort of reminders. And so we know making decisions about a project is difficult and it can feel like important issues for groups and or communities may get lost. So we wanted to take a moment to remind members that the Title V Maternal Child Health Block Grant has a long history of supporting vulnerable populations and meeting the needs of the maternal child health population in ways that other federally funded programs have not been able to. And so Medical Home for Children is no different. So states and territories are charged with creating action plans around medical home. And so that is for children 1 through 21, which is inclusive of CSHCS. And then our CSHCS colleagues also have the specific charge to create an action plan that is specifically focused on the CSHCS population. And so we've been partnering with our colleagues in CSHCS throughout this process so that both state and local partners can better meet the needs of all Michigan children. And our CSHCS colleagues are leading the action plan and work for CSHCS as they're the experts. And we want to be mindful of that and respectful of that. At the same time, we are working closely with them to really learn from them and find ways to support the needs of all Michigan families so that way we can complement each other in our action plans that we are creating from this process. And so as we continue discussion today around strengths, so things that are going well for kiddos and their families, as well as challenges, so things that can be improved, we want the group to focus on being creative, leaning into your experiences, and being thoughtful about potential solutions. So those ideas that can make the system better for all families. And this group has done an incredible job narrowing the focus on issues that can truly make a difference in the lives of kiddos and their families seeking healthcare services. And we are deeply grateful to you all for the time and energy that you have invested in this group. So thank you. Carrie, anything else you would like to add?
Yeah, well, thank you for everything you said, Jessica. You're right on. I think, you know, again, just like kind of giving you a behind the scenes of what some of the conversation has been as we think about the stage of where we're at, and had a conversation like, are there any parameters that we want to put on this leg of the discussion and prioritization? And, you know, right now there really isn't any parameters. We really just want to see the process through, have all ideas to come forward, activities come forward. And if at some point we have an activity that for whatever reason is either outside the scope of the Title V block grant, outside the scope of the state team or the capacity of the state team, you know, we will deal with that then, and we'll have a conversation with you all about that as we continue this process. But as of like now, we just want you know, all ideas and all thoughts to come forward, and you know, not to be worried about parameters right now. That really just want the creativity and the knowledge of this group to like see the process forward. And if there are some parameters that come up later on down the road, like we will be as transparent with you all as possible and have conversations about why that's the case, and you know, what we can do about it and things like that. So just wanted to share some of those behind the scenes conversations.
Okay, and I think to try to keep us on track for today, since we only have a short time together, I'm going to pass it over to Gloria so she can review the results of the survey with us, because we know that not everyone can always attend every meeting, so we wanted to give members a chance to sort of weigh in on those priorities. And so Gloria is going to give us sort of those revised results, or our collective results rather, not revised.
Yes, thank you, Jessica. And I'll go ahead and share my screen that has a summary of our results. So during the meeting, there was voting on our potential priorities that we put into a matrix of what would have the most impact versus what is most feasible for Title V to work on. And then we also sent out that poll to members afterwards who were not able to attend to get their feedback. And then we compiled all of that information together. And so what you're seeing here is those priorities that were either very clearly top voted priorities. Those are the ones in green. And then we also have ones that were tied for a top spot. Those are the ones in pink. And then we had a few also that the Title V team brought up as priorities that had kind of close voting results to those tied votes as well. And so what we were proposing with this is that we would take those pieces and notice some commonalities, some areas of overlap, and we're thinking of nesting some of these pieces together um, so that there will be these 4 core pieces that priorities that we're working on, and then some of the other ones that were tied pieces or other priorities that that Title V selected that we want to keep as informing potential strategies or root causes of those priorities. So starting over here on the left, we have, this was from the family-centered care priority matrix. Providers and staff need additional support and education in providing family-centered care. This was, sorry, I'll just zoom in. So make sure, can you all read this okay? I know the text is a little small. Is that good?
If you got any
Yes.
way of just bumping it up, maybe to
Yeah,
double.
maybe I'll just, yeah, just since we're talking about this over here on the right, I'll focus in on that.
Thanks, Gloria.
Yeah, no, it's a lot of text. It's hard to see, but so providers and staff need additional support and education in providing family-centered care. So other priorities that were tied were kind of related to this that we thought we could nest under this priority as potential areas to inform what strategies we take are the data points from the National Survey of Children's Health around non-Hispanic Black families being less likely to report receiving care coordination compared to non-Hispanic white and Hispanic families, and then Hispanic and non-Hispanic Black families being less likely to report receiving family-centered care compared to non-Hispanic white families. And the reason why we thought these were kind of both can go together is like technically care coordination is a component of family-centered care. And so it does kind of nicely kind of fit under the same umbrella. And that we can, when we're thinking about strategies to inform this, we can think about kind of targeting our interventions or strategies to make an impact for these populations. The next priority that got like very clearly higher votes was communication challenges between healthcare settings and system players impacts care coordination. And as if we remember the kind of system map that we created as a group, families and patients are a part of that system. So we thought that we could nest the another priority that got tied, 7 votes total, that families are not often aware of what a medical home is and what services are provided, that we could nest that under this priority about communication challenges and awareness. And then another priority that got around 7 votes. We have related to family-centered care, parents value being respected partners in their child's health care. And so some 2 other priorities that we thought kind of fit underneath this umbrella are those interactions with front office staff influencing parents' experiences, and parents valuing care coordination and being a decision maker in the referral process. And then lastly, the Title V wanted to elevate the priority of providers and staff are often confused on how to bill for care coordination services. And this also relates to another priority on the matrix around clinical staff are able to work with a physician, a nurse practitioner, or PA to bill for care coordination. So this could potentially be kind of a strategy related to getting at that confusion. And so just to give you all an example of kind of what we're thinking of these how these kind of nested priorities can work together as like potential solutions or potential root causes. We have a mock or example root cause using one of our priorities. So this is something that we're going to be doing together in a minute later on in during this meeting is root cause analyses for these top priorities that we're selecting. Um, and so looking at um, the the priority around providers and staff needing additional support and education in providing family-centered care. Um, we drafted some example root causes. Y'all, when we get into a discussion, y'all can edit these as needed. But just as an example of how we can fit in some of those other nested strategies, um, we have, a potential root cause is that existing opportunities for continuing education credits often don't cover family-centered care. And then we ask, well, why is that? So maybe there's limited awareness of how much family-centered care can improve care outcomes. And maybe that is because there's less awareness or importance placed on family-centered care compared to other elements of care. And so some potential strategies could work on building that awareness of the impacts of family-centered care and creating continuing education opportunities related to that. And because we see that non-Hispanic, Black, and Hispanic families report receiving less family-centered care, we could focus those efforts to providers and practices that are serving those communities. So that's just an example of how we can kind of utilize this structure of nesting some of those pieces that were tied or some additional pieces into like umbrella categories, if that makes sense. So I know I just talked a lot at everyone, so I'm going to pause and see if there's anything that's confusing or you would like, needs clarification or anything that stands out. We'd love to hear like what you think about this proposal of nesting these tied pieces together in different ways. And if there's any confusion about why we put something under one priority. See, Tara said she appreciates the nesting. Does anyone else feel like this is a good direction to go in, or is someone concerned about losing focus on any of these pieces?
One thing I liked about nesting was that we were able to pull in more strategies that are, more priorities with the nesting concept than if we would have just focused on like that top tier. So selfishly, I liked it because it felt like we didn't have to make as many hard decisions about, some really important things that maybe wouldn't have, like risen up in the priority process.
I feel like the nesting makes good sense. I also wonder from a implementation perspective if there'll be the opportunity to sort of link 1 and 4 together. Because certainly after, I'm just curious, like if, I mean, the learning how to better provide family-centered care will go right along with making sure that it's, they understand how to bill for it.
Mhm. Yeah, that's a really good point. I appreciate that connection and can actually just, oh, sorry, I was going to put in an arrow to just make a new arrow here to this one. Those are linked. It's small though, but we'll make sure to keep those in mind as potentially when we're thinking about strategies. And that's another thing that may come up too when we're looking at the root cause analysis. And if things have common causes, they may have common strategies that can get at um, multiple of our priorities. Um, so yeah, that's a really good point of kind of um, yeah, kind of getting at 2 things with one kind of education component. Kristen, I see you got your hand up.
I apologize. I had to step away for a minute, so maybe I missed this, but I'm having a hard time connecting number 2 and 7. Can you?
Yeah, so this one, we were thinking of families as being kind of at the center of that, our healthcare system, our healthcare environment. Um, and so making sure that while we're working on those communication challenges in different settings and making sure that all of the system players are communicating with each other, that families are also involved in that communication. But we're also open to, like, if there's another place where you feel like this could be nested under, like if it feels like this is part of that, like parents being respected in their children's care, of like knowing about what a medical home is, what their options are. We're open to those different points, or if you think it should be, a standalone piece too.
Yeah, I'm just thinking, right now that because of poor communications, families have to be the communicator. Like that seems like putting it on the families when it shouldn't be. Um, okay, let me think about it. I wasn't clear there how that was connected. Thank you. Sorry,
Yeah,
I did have to step away, so I may have missed something.
yeah, no, and that's, I think when we were thinking of nesting this underneath this, it's not that this is the only piece that we would keep in mind for strategies. It's just one of the pieces that was highly voted that we want to make sure is captured
Okay.
and tied to something and doesn't get lost. Um,
Yeah, I
but
guess I see more of a connection between 3 and 7 than 2.
okay,
But,
yeah. Is anyone else seeing that too?
maybe not.
I think I could definitely see that, make the case for either. Um, and I think during our internal discussions too, we kind of saw that as well. So it's not just you.
Okay, thank you.
For the time being, we'll add both a line here. Oh, that's very big. Just so that we're capturing that connection, that is also related. Anyone else have any other concerns or suggestions for how these priorities are relating to each other? and Tia had a comment in the chat about just kind of agreeing with you, Kristen, that while it can, the awareness of medical home is a communication barrier gap, but we can definitely see how it's possible to nester under that education as well. Okay. Well, if there are no other comments or suggestions on how to move this around, we just want to get a quick, like, either a thumbs up in the chat or under like reactions of if y'all are okay with moving forward with these top priorities here on the top of being kind of our core focus, and then these categories underneath being priorities that would inform the strategies that we take for those.
Oh, and I want to say too, this is Jessica, if folks need more time, please let us know. Like, I know I personally don't always do well when you're having a lot of things thrown at you and you're like, make these decisions, and you're like, just not enough time. Or at least that's how I always feel about it. So if there are others who feel like they need a little more processing time and want to talk it out, please let us know, because we're happy to give that time and space.
Got a thumbs up from Monique, thank you.
And Azra had given a thumbs up earlier, so
Okay.
If we could just get a couple other thumbs up, just so that way we know that folks are comfortable just kind of moving forward, we'd appreciate that. Thank you. Awesome. Oh, those bursts.
So yeah, and as we're going through our next step, which is root cause analysis, this may also help kind of think through some of these of like where they have some common root causes that we want to address, and kind of help make those connections and overlap a little bit clearer before finalizing. So with that, continue. If you've got any other questions, please, continue to put those in the chat, but we're going to move on just for the sake of time. What we're going to do next is a root cause analysis for those top 4 priorities that we just went over. And this is in order to really understand what's going on with each of these issues, so that before we start developing strategies, we have a clear idea of what are the moving pieces that are causing the situation, whether that be a strength or a challenge. And so we're using this particular tool is called a tree diagram, where you have your issue at the far left. You have in blue, those boxes are kind of, you could have more than 3, but to start, you might want to have 3 of kind of like, what are the things that immediately come to mind that are causing the issue, or the context for a strength, things like that. And then for each of those blue boxes, you want to ask, okay, why is that happening? And then that goes into that reddish orange, and then goes into the next color. So any questions? I'm going to give an example, but just questions so far about anything that I've gone over in terms of what this tree diagram is talking about. Has anyone seen this type of tool before or worked with the root cause analysis? Thumbs up or hands up? See, Amy gave a thumbs up. Awesome. Kind of, okay. Yeah, there's lots of different ways that you can use tools like this. Another example, you may have done like the 5 whys, which is another root cause analysis where you ask, why does this happen? You know, 5 times, kind of getting it at more and more detail. So this is a different tool for doing kind of a very similar exercise. All right, but we're going to go into a quick example that hopefully some of y'all can relate to, just kind of thinking outside of our project scope to everyday life. We've got our issue over here, which is your family orders takeout for dinner more days of the week than you would like. And so maybe you've got your particular potential reasons for why that might happen. You don't have the ingredients, you don't have the energy, you don't know the recipes. And then for each of those, you would follow, okay, why does that happen? So looking at just this top line, you know, this limited ingredients for quick meals. Maybe we find that there's no meal or grocery plan for the week, and that's why those ingredients don't end up in the house. And then when we ask why, it's because it takes too much mental energy to create a meal plan. And so kind of looking at the root causes that we came to with the other root causes of, you know, we've got to work, we've got to keep the kids active, busy with life. There's not too much wiggle room with those. Like that's probably going to stay the same, but this taking too much mental energy to create a meal plan. Maybe this is something the family can work with. So select this root cause to focus on and brainstorm strategies to make meal planning easier and more, not take as much of that mental energy. And on the flip side, so some of the priorities that we're going to be working with are strengths, not challenges. So we wanted to show an example of how you could do this with a strength as well. So maybe you have a friend who has been able to cook at home for most meals during the week. And you did some digging, asked them, why are you able to do this? And, you know, looking at this top line, one of the reasons is that they have lots of quick meal ideas ready. And when you ask, okay, why, how do you do that? They found a really great website that has very quick, tasty recipes. And maybe it's easy to follow. It doesn't have like the essay length blog in front of the recipe that you have to scroll through. So the family selects this to kind of test out and see if this could make any improvement. And you know, we may find as y'all are doing these examples that some root causes could be paired together in terms of the strategies that would address them. And then you may find certain root causes are really difficult to move. And so maybe that's not where we put our effort in changing things right now if it's outside of our scope or feasibility. So any questions with those examples? All right. So we're going to go back over to this example that we had previously about providers and staff and needing additional support and education in providing family-centered care. So we're going to kind of do this together a little bit. I know there's some pieces here already from the example, but if there's anything that you think we would want to change, well, you can kind of walk through this as a group. And then we're going to, I think we have enough people that we can do breakout rooms. And for the rest of our time, we'll kind of work on the root cause analysis for these different priorities in breakout rooms. So first, looking at this, our first priority of needing additional support and education, kind of thinking about why that is. We'll first start with if there's anything that you would change in terms of what is already on the example here. Anything that doesn't seem like this is really applicable. It was good for the example, but like it might not actually be the case.
I have one thought, and that is providers, it says need more support and staff need more support. And I'm thinking that as staffing itself, that they need more. It says providers are pressed for time, but I think providers are also pressed for the staff to do the family-centered care. Does that make sense?
Yeah. Do you think that's kind of like partly a reason for that? Of like,
That could be. It could be for
okay.
the root for press for time is not enough staffing to
Mhm.
cover the job. Yeah.
And Azra, I see your hand is up.
Yes. Um, I've noticed that though there's a lot of available trainings for things, they're not in-depth trainings. There have been a lot of surface level trainings or just watch a video or do this quick interactive kind of training, but not as detailed.
Mm, okay. So we could maybe put that, would you group that kind of under these existing opportunities
Yes.
or kind of, okay. Anything else that the group would add in terms of kind of like some of the reasons for why some of what we've already placed on the analysis is happening, or any additional root causes that aren't covered? Just make sure that.
I don't see a place on here where we speak to the frustration that providers feel when they're trying to connect families with other resources, right? So if you're providing true family-centered care, you're likely to identify needs that are outside the control of that provider. And what I often hear is like, we're afraid to do a screening because we're afraid of what we'll find. And then those things are not available in our community to connect families to. So I think I just wonder if there's times when people have tried to provide more family-centered care and then been frustrated that they can't actually meet the needs because of things that families need are not within their control. And I don't know if there's an easy answer to that. I'm just trying to sort of give voice to some of the things I've heard about providers, you know, when they do enter into some of these spaces that are more complicated.
Mhm. Yeah, no, that's a really good point. I think it kind of connects a little bit to that providers are pressed for time, but also its own separate issue of like you said, of like the resources and in the community not being there.
I think it also connects to family-centered care not covered in initial training or CEUs. Sometimes they just don't know what resources are out there.
Yeah, and this is an example, I think, of when if something connects to potentially multiple pieces, you can always kind of use your arrows um, to kind of show those connections, but to not worry too much about directions and all of that. I think the point is more to like capture as many of the root causes that we can, and then we can kind of see where there's similarities, and then again that informs our our potential strategies that we're taking.
So taking Kristen's comment, I wonder about going beyond the box you created for what I said and just saying that providers need to be more aware of what's available in the
Mhm.
community.
Yeah.
And also I think those resources need to make it easier for providers, right? Like we have this conversation all the time about home visiting. There's so many different home visiting models. And we would like to see pediatricians refer more families for home visiting, but they quickly get overwhelmed with like what's even available in my community? What are the criteria? How do I refer a family? So it's, I think it's, you know, again, making sure we don't put the onus on families. I think it's up to providers to be aware of what's in the community, but also for the community resources to make sure that providers have the information they need.
I think that's a good point because it is complicated, especially when you start getting into what's available, who's eligible, how do you refer? Like that's a whole nother person in your office to keep up and manage that.
Well, and just a really, like to your point, Kristen, it takes a whole nother person and it's such a skill set, right? Like they have to just be like someone who's really on top of what's available in the community and like the kind of person who will go the extra mile to connect families to those things.
And I saw in the chat, Julia mentioned, I also want to note that there are power differentials between providers and families that may get in the way of fostering those respectful and empowering interactions. Thank you for that. I'm wondering if y'all think that this is something that could be kind of nested within one of these existing root causes that we've already identified, or if it's kind of a standalone.
I think it might be more of a standalone because I mean, I think that family-centered care is asking for a paradigm shift for providers, but the broader system that providers are part of, including the system for educating and providing continuous support, including the system for payment, including the structures of teams, all of those parts and pieces can support or get in the way of the kinds of equitable, respectful, empowering interactions that family-centered care is asking for.
I also wonder if it needs to be like linked somehow to the training, right? Because, you know, obviously that's understanding, you know, that, like you said, that mind shift, Julia, as part of the training, and then thinking about like, how do you, I just would hope, like Ezra mentioned, that the training would be in depth, not only about the why, but about the how.
I think you just adding that as a comment to think about when we're thinking about strategies. So I think for just recognizing that we have just 12 minutes together, I think what we're thinking in terms of next steps is for y'all to think about which, whether you would like to kind of dive into our priorities related to family-centered care or care coordination for our next meeting, and kind of sign up for which root cause analysis you would like to work on. So for family-centered care, the remaining piece for this, I think the other one is parents value being respected and respected partners in their child's health care. So continuing to work on that one. And then for care coordination, the communication challenges between healthcare settings and assisted players. And then providers and staff often confused on how to bill for care coordination services. So those would be the areas that next time we'll be diving into more. So if you want to think about, before then, of which pieces you would like to work on during that meeting. For now, for our, last, maybe you can take another like 5 minutes to think about if there are any additional root causes for this piece that that aren't pictured here that we want to make sure are captured. Or another thing to think about is, are there particular root causes that we've named that we think we could have particular leverage with, that we would want to, maybe put a different color on or something like that to make note that those could be potential areas for our strategies to focus on.
Gloria, I did want to thank you for that, and I really appreciate all of this great discussion. I did want to note one comment in the chat from Sarah Davis about, along with the providers being pressed for time and not enough staffing. Seems like another challenge that we've heard is that existing staff are pressed for time, but because they're often wearing many hats. So that could be incorporated into the board.
Yeah, thank you. Sorry that I didn't see that one. Goodness. Is that capturing? Sorry, I'm struggling a little bit. Maybe I'll just look to your comment. Okay. I'll just copy that language directly. And does that make sense, Sarah? Like having that kind of nested under the providers are pressed for time? Or do you feel like that's connected somewhere else?
Thank you. Yeah, I mean, I feel like it's connected to the providers are pressed for time. I'm not sure if it's like a root cause of the not enough staffing. It feels kind of like parallel to that. Like there's not enough staffing and existing staff are pressed for time. But I mean, I'm not sure that it matters exactly right now where it falls.
And then Dr. Kilmer said for initial training, there's no standardized training recommendations for office onboarding.
I'll just say that I'm aware of. There may be some in some systems, but I don't know in private practices or where I've come from that there was any outline of what issues to cover. Certainly not family-centered medical homes or patient-centered medical homes.
And then Julie had a point about wondering if providers and staff receive feedback about the degree to which they care, to which the care they provide is family-centered. Are there providers here who can speak to that? kind of thinking if that's part of like patient satisfaction surveys or any other like regular feedback that providers get. Does anyone in the group know?
Again, I would just say that it kind of depends on the practice. So in private practices, I don't know if there's any standardized patient assessment other than maybe complaints that come into the office, but in hospital-based practices and system-based practice where there might be surveys that are sent out. I don't know, maybe Dr. Van Houw can comment since he came from a pediatric office.
Yeah, part of patient satisfaction surveys, I think they would have to specifically ask questions about whether these things took place. I mean, like as someone mentioned earlier, it's a huge paradigm shift, and for these hospital systems, it's a big move for them, and it's also a big commitment for them. So probably is some hesitancy involved. But I think what you would have to do is ask specific questions. And I don't know if you'd want to embed that in, like the Press Ganey surveys they're like 15, 20, 30 questions. Might be easier just for a practice to, choose some people who are in their practice, maybe 10 or 20, to just get a quick feedback on whether they felt that the patient-centered medical home practices were being implemented. So, yeah, the other comment I have is that the people that we refer to can be a revolving door. So you don't know from week to week whether the people you refer to are still there. So that makes it a little bit more difficult. One of the things we see in public health department is that people would like to have a list of current resources that they can go to, and those are hard to maintain.
Yeah, thank you for that. Just making sure that that's kind of connected to that awareness of resources. And just looking at the chat, Sarah said, to build on Julie's comment, whether office staff are aware of the degree to which family-centered care or staff interactions impact the family experience care. Yeah, I think that kind of gets on that limited awareness of how family-centered care can improve outcomes. But like, I think you're thinking kind of like particular to their practice too, right?
Yeah, I think it ties into and captures the one that you just noted.
Well, we've got 3 minutes left in our meeting. So what I do want to give time for kind of like wrap up and discussing next steps. So again, we'll kind of be going through this process at our next meeting to kind of identify root causes, and then the following meeting after that, kind of utilize these root causes to brainstorm some strategies that we can recommend for the Title V team to include in their action plan. So I'm going to pass it on to Jessica, who is going to wrap up for us today.
Yes, thank you all so much for the great discussion today. There were a lot of great points. Again, we value your feedback. Please let us know how today's meeting went. And then, surprise, we have another meeting planned. I know because we've been having such great discussion and thoughtful discussion. And we all know you're very busy, so we only have like limited amounts of time. So we're gonna schedule. I will send it out as soon as we're done here. We're gonna schedule a meeting for September 16th from 9 to 10 a.m. We'll use the same Zoom link as today. And if you're able to make it, we would love to have you, but we understand that, you know, some of you have prayer commitments, other standing meetings that you need to attend. But we will schedule that one so we can try and get a little bit farther through the root cause analysis, because then at the end of the month is like our last sort of regularly scheduled meeting, but we'll kind of chat more with the group at that. Sorry, I'm making sure I'm in the right month. Yes, so at that September 24th meeting, sort of like about next steps for the group, since that is our last regularly scheduled meeting. But so yeah, so that'll be coming to you today. And then yes, please, please, please complete the evaluation. We really, it just helps us to know how things are going and where we need to adjust. The sun is shining for now, at least where I am. So I hope it is for you all as well, and that, you know, you can find some small moments of joy in your day. And just again, we really appreciate you all hanging in there with us, investing your time and energy in this process, because it's better because of you. So thank you all.